developing country still battles wash and eat-related issues, even though there has been some improvement over the years due to the immense contribution of civil society organizations and non-governmental organizations who have played active role in the wash sector here in Ghana. I am Jessica Ahedo. Join me as we explore the impact of the 4 major wash sector players here in Ghana on their respective communities. Like many developing countries in the world, is also fraught with water, sanitation and hygiene challenges. These challenges comprise inadequate supply of safe drinking water to rural and peri-urban areas, irregular supply of potable drinking water, large water loss on the way to the consumer, and inadequate sanitation and wastewater infrastructure to satisfy the needs and the demands of the growing population. Though various strategies to ensure access to water across the country emerge, these measures are not reflective of the situation in many communities in rural and peri-urban Ghana.
The young dear, and Yakura, my young chili pa. So, by sample now, what will be Bahana with the man on our ferry? You need to be answered. Ewa Hakano, and Unquani, you soon tell me, dear, young chili, ewa hapa. Say a person say ya, and she need to marry you could now, yes, to moody guardian. Now, down who say put up. About Adriana, and Adriana, you say two. And so I jay any baby, I was 70. No one is using Kakra.
And so we na sesia yasa. But first na sansunu ewo anim ho. Na asai okosa mboankwa na ya de ba hanum. Sesia we no na boa ye kakra. Na bet nsuo to a na apia wura abegum obeba condemn omobo condemn agya ayinu ntunturo no nyina na apia abegu nsuo no. Nsuo to a gise mba no ba no bi wura firi nsuo no nsa na omatimi asa nsuo na ba fie nsuo we na ye no.
With an estimated population of 30 million with an annual growth rate of 2.5% according to the Ghana Statistical Service and the World Bank Group, the country's population is expected to double by 2050. This means the current disparities that exist will deepen if the country does not prioritize wash and allocate resources equitably.
Yes, you almost sense your form. If you can see your say, now I pray rubber brain, and the Abegun Sonimu, a good condemn. What is I idea chemical? Yeah, this is Asura. At the end of the day, you're rainy season, no, sir, I chemical, a best wash it in Suta, a best supinion. Net nako downstream na ase nsuo na da kwan efom a akuafo ne sanom ni nyina ya challenging ewo electoral enu yeni nsuo papa bia ye no nsuo na ye se abura bisa na yetu na eta ho ono ne.
One thing I noticed about them when I visited their communities was that they don't have good drinking water. So I took it upon myself to trumpet their needs through social media, and with that we've been able to get about 8 mechanized boreholes for some of the communities. With the people of Bonyere, Seshi Bonyere, they were also fetching waters from stream. I would say even gutter. It's very dirty water. Water I will even not use in washing my shoes, but that's what they were taking.
The World Health Organization, WHO, and UNICEF's joint report in 2015-2016 says probably one rural household out of 10 were using improved household toilets, while 3 in every 10 of them practice open defecation, and not a single district in Ghana has achieved an open defecation-free status. In early 2000, the coalition of NGOs in WASH, nicknamed CONIWAS, began to drum home demands for equity and accountability in the WASH sector. Their efforts eventually birthed the independent agency called the Community Water and Sanitation Agency to drive WASH and its related issues in Ghana.
Over the years, CONIWAS has made significant contributions in the area of policy development. So all the major policies that you find in the country, the water policy, the environmental sanitation policy, the integrated water resources management strategy, the DESAPs, the NESAPs, all the policies and strategies that we have in this country, CONIWAS made significant contributions to them. When it comes to implementation, it is the members of CONIWAS who drive implementation of these policies and plans. And so when it comes to service delivery, the contribution is huge in terms of provision of water, sanitation and hygiene facilities, whether at the community level, whether at the institutional level. CONIWAS' contribution has been solid. But perhaps one major contribution that I will say CONIWAS has made will be in the area of accountability in terms of governance. Remember that we had this 5% capital contribution, upfront contribution. Before a community can benefit from a water system, for example, they had to make a contribution of 5% of the cost of the facility upfront. And we thought that no, communities are not in the position to be able to make such a provision. So we advocated, and fortunately for us in 2011, that policy was taken off. And so now communities no longer have to make such a contribution. They can contribute by way of in kind. Labor, water, sand and stones and all that. So that has made life quite easy. In terms of institutional development, when it comes to the development of or the establishment of the Community Water and Sanitation Agency, it was as a result of the persistent call on government to establish the CWSA, because we thought that the Rural and Small Town Water Supply Department was losing out. And so when CWSA was established, we all can testify that CWSA is making huge contributions in terms of rural and small town water supply. Apart from all these, when you come to the engagement with government, contribution to sector development, I think is also major. Our relationship with the communities in terms of explaining government policies to the communities, I think that is also a very solid contribution.
Ghana's Multiple Indicator Cluster Survey 2017-2018, spearheaded by UNICEF and its partners, saw the country's national coverage of basic drinking water, sanitation and hygiene at 79, 21 and 48 respectively. The data also revealed 76% of households in Ghana are at risk of drinking contaminated water with E. coli, while sanitation, on the other hand, is contending with funding, lack of prioritization, and coordinated efforts coupled with attitudinal change issues.
UNICEF focuses on 4 areas. One is the kind of system strengthening, which is all about improving the capacity of the government, improving the capacity of the institution, so that they are better able to plan and monitor the sector progress. And then the other area is we provide directly services to the population, support government in providing services to the population through UNICEF technical and financial support. And those services will be in the area of the sanitation, both urban and rural, in the area of water supply, and then in the area of washing institution. And then when it comes to services, we are focused on kind of supporting the those areas which have significant gaps. So our support in the last 5 years have been mostly in northern part of the country, where the gaps are significant, were significant at least at the point we started. And then we are also focusing in Volta and central region in the rural part of the country. So why we are there is because if you go back 2014 or 15, you will find that in northern regions, average between 80 to 90% of the population or household were practicing open defecation. And you can understand, if so many people practice open defecation, the manifestation of disease, diarrhea, and so forth, the impact on public health is going to be significant. It was significant. So over the last 5 years, a significant change has happened. We supported government in devising a implementation model called Rural Sanitation Model Strategy, which has the behavior change component, which leads to the demand creation for latrine, for example, and which has technical support to the district level environmental health officer, which has a component of training the artisan who can go and support families to build the toilet, and then also establishing small businesses who can do the business of toilet, in the sense that they provide service to the families who need to build the toilet or who want to build the toilet. And above all, support in monitoring the progress and see where are the gaps, so that the government, MMDAs can put more extra effort. So implementing this rural sanitation model strategy over the last 5 years, there has been a big shift in the north. The open defecation on an average has gone down by 20 to 25%. That's in five years, that's a big achievement. So likewise, we have also started seeing that urban poor areas also suffer from significant gaps. So we are also implementing, supporting government to implement urban sanitation program. We are modeling that approach similar to rural area in Tamale, Ho, and Asaiman. And from 2020, we have started in Cape Coast and Almina as well. Likewise, our support is also on washing institution. We are in right path, but especially because the overseas aid is reducing, Ghana going beyond aid, Ghana promoting more investment and business, meaning that the grants and aids are dwindling, going substantially down. That indicates that the portfolio of wash sector funding has to be diversified. So the current investment has increased from the government side since 2016-17, but not enough, needs to be doubled. To be honest, to reach the SDG targets by 2030, universal access to safe water and universal access to safely managed sanitation, I think it has to be even tripled.
According to WaterAid 2013 and WHO 2015 assessment of financing mechanism in the wash sector over the years shows that Ghana has enjoyed the support of external agencies in funding developmental projects in this sector. Domestic expenditure towards providing potable drinking water represents less than 0.5% of Ghana's gross domestic products, GDP, in contrast to the many commitments and international treaties signed.
We really need to double up as a country in terms of our approach to addressing the water sanitation wash needs. It also means we have to be more serious with our investment in the sector. It also means we need to also strengthen collaboration, because when you look at water sanitation hygiene, it is really linked to all the other SDGs. We cannot talk of health without talking about water sanitation hygiene. We cannot talk of education. We cannot talk of issue of poverty. So they are all linked.
You can even not talk of issue of climate change without looking at the issue of wash. So when you take every single SDG, you could see that water sanitation and hygiene is a fundamental to that particular SDG. So that has really been, so it has become the bedrock for us to really help deliver other SDGs. So we really need to, as I said, double up with our investment, double up with our collaboration, and double up with our approach. We shouldn't go by the normal approach of getting addressing this when we're really in the MDG era. But we need to really look at our approach that will help us to, as fast as possible, reach as many people, if possible, all the people in the country by 2030. Okay. Our vision is to ensure that everyone everywhere will have access to safe water and improve sanitation and hygiene by 2030. So that has been the vision that's guiding our strategy. And we do little and influence the rest. And what I just want to indicate is that we know government is the leader in terms of development. NGOs are there to complement the effort of government. So we are not government, that is one fact. So what we do is that based on our experiences and our documentation and our best practices, we influence government policy to ensure that government will really buy into that policy, that approach that will help us to really achieve our SDGs by 2030. So water aid in area that we have been working for the past 5 years is to focus our attention in a very deprived and marginalized areas. Even though we are in SDG era, but government is still using the MDG strategies and policies to implement activities to. So we really influence government to start rethinking. And they have started the process of reviewing all the water sanitation policies. Some of them have been obsolete. And that is one thing. So water is playing a critical role with other sector players to ensure that government come out with policies and programs that are relevant relevant for our time, this current times is concerned, to ensure that we can really work towards achieving the SDGs.
Since most of these industry players are mostly donor-funded or non-profit organizations who rely heavily on benevolent organizations for funding the select areas they operate. As such, their value for money after implementation is scooped from the various communities they undertake their activities.
Our contribution within the 5 years has been, very good. We've worked with partners and stakeholders. Of course, we do not do it alone. For WhatsApp, our focus is how do we empower the service provider, that is those with the mandate to deliver WASH services. How do we empower them to make sure they are able to deliver improvement in WASH? And over the last 5 years, for sanitation, for instance, we've worked to see how do we work through the entire sanitation value chain, especially in Kumasi, where we've worked so well with the Kumasi Metropolitan Assembly. How do we work from containment? How do we work to see which options are there for access to toilets? So we've worked with them on household toilets, bringing along private sector operators, that is financial institutions, partnering with other CSOs and other WASH partners as well to be able to develop a market for sanitation services in Kumasi. Down the lane, we've also looked at how do you transport that waste, for instance, where we've engaged in systems to be able to deliver and improve a system for vacuum tanker operators to operate safely in Kumasi. Most importantly, having them into an association where they have a common platform to interface with the assembly on their operational issues. And down the chain again too, we've worked with the Kumasi Metropolitan Assembly on the rehabilitation of their waste treatment systems, for instance. So once you look at this, and we've conducted an extensive study on waste to resource on some of these facilities as well. So once you look at these things, then you realize the impact cut across the entire sanitation value chain. And I think the culmination of these efforts, with the leadership of KMA and the other supporters, is the award that KMA won as the best Metropolitan Assembly in Ghana with the best sanitation liquid waste strategy in Ghana, which they had £400,000 award from that. And this is a culmination of all the work we've done with them, with the leadership of the Assembly and other partners as well. Again, you come to water, where we've worked extensively with the Low-Income Consumer Support Unit of Ghana Water, for instance, to ensure we support low-income areas with improved access to water, where we've worked in other locations. In Kumasi, for instance, we supported some communities with water reaching about 45,000 beneficiaries. We've also partnered with Community Water and Sanitation Authority, for instance, working in some small town communities in the Ashanti region as well. So overall, and you look at this, it's not just the systems you develop, or it's not just the infrastructure you put in, but how are you making sure the systemic issues that are impacting negatively or adversely affecting water service delivery are addressed. And for this, we are working with the Ministry of Sanitation and Water Resource, for instance. We supported in an extensive research on the establishment of a National Sanitation Authority, which we see as being pivotal to coordinating the sanitation sector, being the overarching authority that would come in to ensure services that are being delivered are up to standard and to ensure that these services are accurately monitored.
Although Ghana's wash sector has seen improvement over the years due to active participation of CSOs and NGOs, there are still inequalities that exist since these players are unable to cover the entire country due to financial constraints, lack of proper planning and coordination of programs aimed at improving sanitation at all levels in various institutions, while others cry for donor funding as a result of Ghana's quest to go beyond aid. From all indications, it is critical for Ghana to prioritize WASH and its related funding domestically to augment the efforts of civil society organizations and non-governmental organizations in order to bridge the existing gaps in WASH.